guys, this is Dr. John Jaziri coming to you from San Clemente, California. And in today's video, we're going to be discussing the topics of, are you a candidate for dental implants? So you may have gone to your dentist and your dentist doesn't do implant, or they don't do a lot of implants, and they say, oh, well, you can't do an implant. You have to do a bridge. You can't do an implant. You have to do dentures. Well, I'm going to tell you in this video exactly what it takes to do a dental implant and explain to you why 95% of the time you can do an implant and what it takes in order for the implant to succeed in each particular case. Now, this video is only for simple cases, so we're going to be discussing placing 1 or 2 implants in the front or in the back. If you guys are looking for full mouth cases, more complex cases, such as all-on-4, over dentures, snap-on dentures, and full mouth implants, I'm going to make another video, which I'll put a description in the box below. You guys can check that out. But this video is going to just discuss replacing 1 or 2 implants in the front or in the back region. Okay guys, so here's how we're going to do this video. We're going to break them out into 4 sections, and in each part of my video, I'll discuss one particular section. Okay, so the mouth is going to be broken out into the upper anterior, lower anterior, upper posterior, lower posterior, and for each one, we're going to describe exactly what it takes to place the implant in that particular area. Because if you want to put an implant here versus here, there's a huge difference based on exactly where the implant's going. And if somebody calls me over the phone and is like, hey doc, I want to put an implant in my mouth, the first thing that I want to know is, where is this implant going? Is it in the front, in the back, in the top, or the bottom? So what we're going to do is we're going to break them out into 4 sections and go over each section at a time, so you guys know exactly by the end of this video what it takes to place an implant, how long it takes, what are the complications, and what I look for when I'm trying to put an implant in your mouth based on the specific region of the implant that is being placed. Okay, I'm talking a mile a minute, guys. Let's get our video started. But before we do that, I want to bring the attention of those of you who currently do not have a dentist or looking to upgrade your dentist, look for a better dentist, to go check out the website even28.com. That's EVEN, the number 2, the number 8.com, like the 28 teeth in your mouth. Even 28 is a dentist search engine. We have profiles of dentists. You can browse through them, learn more about each and every dentist in your area, and when you find one that you like, you can book your appointment all conveniently online from the website even28.com, the dentist search engine. Guys, go check it out, find your dentist, and I hope you enjoyed the video. So guys, let's get started talking about, are you a candidate for implants, starting with the chin area, the lower anterior. Okay, so it's this part right here. We're going to be discussing teeth numbers 22, 23, 24, 25, 26, and 27, the lower anterior teeth. Why am I starting with this area? Because this is by far the easiest area to place an implant. If you're missing a tooth and you're hoping it'll be easy, this is the area where you want it to be. Now, nobody wants to be missing a tooth. Plus, because the tongue sits on this area tends to generally stay clean. People usually don't lose these teeth unless they have bad gum disease. And then in that case, they usually lose several teeth. But regardless of why you've lost a teeth, if you want to place an implant in the lower anterior, in the chin region, this is by far the easiest area to place an implant. Why is that the case? Because first of all, the chin bone is very, very high quality, very stiff bone. When you're placing an implant, you want stiff, strong bone. And the chin bone is the best bone inside of the jaw. You have plenty of it, and it's very sturdy and strong. Additionally, there's no arteries, nerves, or any vital structures in the chin. So you can just put an implant without any concerns how deep you go, and the implant should take, as long as the dentist has some skill levels with that. Okay, so let's go ahead and look at an x-ray to better explain this. This is an x-ray of a patient with no teeth, and what I've done for simplicity is I've marked what are, the landmarks and whatnot. So the area in the lower anterior is here. And as you notice, we have bones to spare here, bones for miles. About 1 inch to 1.5 inches of bone is what you usually find in the chin, mandible area. So as you can see, quite a bit of it. You can easily place an implant as much as you need without worrying about anything. The bone quality is good. These implants are usually done in a matter of months. So if you're missing a tooth there, in a couple months, 2-3 months, you should be not done with it. If it's an infection, maybe add another couple months. But these implants are very simple to do, and they're usually finished in a very timely fashion. And they're basically my favorite because they're the easiest ones to do. So let me show you some actual cases. So the patient was missing the front 4 lower teeth, which is usually the case that happens here, and we placed 2 implants. This would be another case, pretty much exact same scenario, a couple teeth missing, we placed 2 implants. And this is what the final prosthesis would look like. You just basically make a 4-unit implant bridge on top of the 2 implants. This space, there's not enough space for individual implants, so you always have to make an implant bridge there. This is another 4-unit bridge on top of 2 implants, but if you notice the implant was staggered, I didn't place them on the side because I didn't have enough bone here, so I placed them as such, but again, same results. And this patient had very little space, so I got a little bit creative and I put all 4 teeth on 1 implant. Crazy, right? But this worked beautifully. And that explains to you how strong the chin bone is, because I can actually put 4 tiny little crowns in 1 implant, because the implant and the bone quality is so high, there's no vital structure, so I can put a really long implant, go all the way deep, and support the bite pressure. So anyways, lower chin area is the easiest area. So if you're missing a tooth here, don't hesitate. Go talk to your dentist. You are 99% guaranteed that you can do an implant if you find the right dentist and you can work out the finances with them. Guys, the second area we're going to be discussing is the upper anterior region. That's teeth number 6 through 11. These guys right here. In my opinion, this is the second easiest area to place an implant in. Okay, why is that? Again, the bone quality is good, not nearly as good as the chin bone, but it's decent quality of bone. But the thing that makes it very easy to do is there's really no vital structures in this area. Okay, there's no nerves, there's no major arteries, and you have just the nostril cavity, which is usually far above where the bone level is. So this is another area which is very easy to place implants, and we can place implants on pretty much everybody there. Okay, let's go and look at our x-rays to make better sense of it, guys. And so this is the upper anterior region, and if you notice, I drew the nostril cavity, which you can't go past it, but there's always a sufficient amount of bone underneath it, and the bone quality is pretty decent. Okay, so the upper anterior is an area where pretty much almost everybody can do an implant and should do an implant, in fact, in my opinion. The bone quality is decent. Again, you can put a pretty large implant. Now, because the teeth are bigger and the bone isn't as strong, you need more implants to support the teeth. So you can't put 6 implants on 6 teeth on 2 implants like you can with the bottom. You need to put more implants. So if you're missing the front 6 teeth, you need something between 3 to 4 implants, because again, the bone quality is not as good. But regardless, those are things that your dentist is going to treatment plan for you. If you're missing your upper anterior teeth, it's very easy to do implants. You know, you just have this nostril cavity, which is usually up there, almost never becomes an issue, and you can easily place a couple implants there. The healing time is a little bit longer, so if the bottom takes 2, 3, 4 months, this one may take 3, 4, 5 months, and I would usually add an extra month or 2 if it's the top as compared to the bottom for the implants to heal, just because of the quality of the bone. Guys, you never want to rush your teeth. I mean, I know it sucks not having your front teeth, but the implant has to osseointegrate. So when the screw goes into your jaw, it's kind of like when you break your leg and you have to put in a cast for a couple weeks. Well, because bite pressure is so strong, the teeth need, instead of a couple weeks, a couple months. And that couple months depends on how big the implant is, how much bone you have, and the quality of the bone. A lot of it which depends on the area. Anyways, we're getting a little bit off track here, guys, but the upper anterior is another easy area where it's very simple to place implants and success rate is extremely high. Now, the challenge with these teeth becomes not so much the screw portion, but the actual crown, because if the surgery isn't done well, your gums can recede, and what happens is you're going to have teeth that are not very good looking. So let's go to our model here. So if this, let's say you need an implant for this tooth, number 7 or 10, which are very common teeth to break. If the procedure isn't done well, your bone is going to drop to here. So now what happens is this tooth and this tooth, instead of, you know, the middle tooth being longer, the side tooth ends up being longer. So anyways, long story short, the cosmetic is what is a concern for the front teeth. And what happens is we always want to make sure that you go to a dentist who's done a lot of these and they do it the correct way, so that when it's all said and done, your teeth look nice and all the front teeth match each other and your implant blends in, because the cosmetic aspect of these upper front teeth is by far the most, you know, visible one. I mean, when you smile, about 80% of what you show is your upper front teeth, right? So you always want to make sure you do a very thorough, comprehensive job, go to a very skilled dentist. And if you do that, yeah, these implants are rather simple to do, and just about everybody is a candidate for implants in the upper anterior region. Okay, guys, the third area where we're going to discuss is the lower posterior region. Okay, so this would be over here and over here. So these are teeth number 18 to 21 and teeth number 28 to 31. Okay, so In my opinion, this is the second most difficult area to put an implant. Why is that? The lower jaw has better quality jawbone than the upper. Okay, so if you're looking at this, we're gonna go back to our x-ray here. The quality of the bone in the lower is always better than the upper. Okay, but the reason I said this area is more difficult than this area is because of the nerve and the artery here, the inferior alveolar nerve. What happens is this nerve can cause an issue. So if you have enough space for an implant, your doctor can put an implant. The problem becomes when your bone is resorbed. So if the bone drops down to here, then there's not gonna be enough space for an implant, okay? So again, we're gonna go back to our model, and I drew it here. When you're placing implants here, there's a nerve here. If your bone is here, fine, you can put the implants. But if your bone has dropped down to this level, then there's not gonna be enough space, okay? You typically need about 10, 12 millimeters, about ½ an inch to place an implant safely without having to worry about intruding on the nerve and the artery there, okay? So if you have anything less than that, that can pose a problem and you might not be able to put an implant in there. So what happens if that's the case? Well, then you're gonna need some serious bone grafting, which could be either powder grafting or in most cases an autogenous graft, which we cut bone from somewhere else and then go ahead and transplant it over here, which is a rather complex case. So if your nerve is too close to the jawbone, then you may not be a simple candidate for implants in the lower posterior region. You may have to do some extensive bone grafting before you're ready to actually place those implants in there. Now, again, how often does this happen? I mean, I would say the majority of patients have enough space. If this space is kind of, compromised, I sometimes put a wider, shorter implant, and that works a lot of times. But sometimes you just have no bone left in that region. And if that's the case, you have to do the grafting, wait a few months, spend a couple $1,000s on just the grafting alone before you can place an implant. So the lower posterior can become difficult if your nerve is too close to the jaw. And the only way to determine that is to take x-rays, a CT scan in all likelihood, to measure exactly how much bone is there and whatnot. But anyways, having said that, there could be some issues just because of the sheer position of the nerve with the lower posterior. If the nerve is nowhere near, which is all the way down there, then it's very simple. And I'll show you a couple cases where we easily placed a whole bunch of implants. Okay, so this patient has a failing bridge. Boom, we put 3 implants. The nerve is all the way down here. Nothing to worry about here. This patient had implants on both sides on the lower posterior. Again, the nerve was pretty close, but we managed to get him in there and everything went well. Pretty big implants, very good success rate. Again here, so as you notice, in most cases, the nerve, is not necessarily close. As you can see, I had to go with a smaller implant because the nerve was a little bit closer there. But if you go to a dentist who's skilled, it's usually never a problem. And again, this is one. If you have the tooth behind and in front of it, the nerve's underneath it, so it's a much easier implant to do. You can do that with your eyes closed. Anyways, the lower posterior area can become an issue sometimes, and you may require some kind of a bone grafting. But again, this is something that needs to be determined on a case-by-case basis. Having said that, because the bone quality is good, there is usually a way to find to put an implant in there if that's what you want to do, guys. But anyways, having said that, in my opinion, that's the third most difficult area. The second most difficult, the third easiest area to put an implant in is the lower posterior region. Guys, the fourth area where we're going to discuss is the upper posterior region. These top back teeth, which on the model would be these guys here. And these are teeth number 2 to 5 and 12 to 15. Okay, the upper posterior teeth are by far the most difficult implants to place for a couple of reasons. First of all, the bone quality here is really bad. You have the sinuses and the upper jaw, which is perforated bone. So the bone quality is much worse than the lower jaw. And the second of all is the sinuses. Your sinuses are back here. They're basically holes in your jaw, to simplify. And you have to worry about these when you're placing an implant. Okay, let's go to our x-ray model so we can better illustrate this. So this is where your sinuses are in the back, and you always have a sinus. Now, some people have sinuses higher, some people have lower, but a lot of people have lower sinuses. And what happens is when you put an implant, the implant is going to perforate the sinus. So you can't do that. You have to push the sinus up, which is called a sinus lift, or if there's not enough bone, you have to do a lateral sinus graft. I have other videos which describe that, but we're not going to get too detailed on that. But anyhow, regardless, the sinus is a problem. So if your sinus is low, you can't just put an implant there. You have to do something to the sinus to lift it up. Otherwise, if you're just going to put the implant there and not regard anything to the sinus, your implant's going to fail and come out, or worst case scenario, it's going to go and get stuck in your sinus, which is not fun. So because of the poor quality of the jawbone in the upper back area and because of the proximity to the sinus, these implants can become a little bit more complicated, and you may require some kind of a sinus treatment before you can actually go and place implants in the upper posterior region. So what do you do in that case, guys? It really depends. At that point, you really have to go and maybe get several consults and see if this is something you can afford or not. And, you may have to go with alternative options of bridges or dentures. But of course, again, each case is different. If there is a way to do an implant, it's worth getting a couple consults to see if you can find a dentist who's willing to do it at a reasonable price. But regardless, this area is always the most difficult. So if you're missing teeth on the top back, left side or right side, this is going to be a little bit more challenging in most cases. Now, of course, again, it's a case-by-case scenario. The sinus position relative to the bone, this is partially genetic. So some people have a lot, some people have very little. And you would need the CT scan to assess all of that. But regardless, if you have an implant in the top back, you just expect this to be more complicated. And usually the treatment time in this area is much longer than anywhere else. I usually wait about 6 months for the back ones to heal. And I've had cases where I have to do sinus lift and grafting, and the implant process takes longer than a year. So if you're missing a top back tooth, just get yourself ready to spend a lot of time with your dentist and possibly go through additional procedures if your plan is to stick with the implant as opposed to other treatments. Guys, so we went and broke them out into 4 sections, and we basically told you how easy or complicated it is to do implants. Easy, mediocre, difficult. Okay, so based on where the implants go in, there's bone quality issues, there are anatomical issues, and those can cause certain challenges. Having said that, again, if you want an implant, there's usually a way to do it, but you may need additional bone grafting, sinus procedures, and that can add to the cost, to the treatment times, which for some people might persuade them to not do implants. That is your decision, so just talk to your doctor, get a couple consults, and make the decision that's the best for your mouth. You never want to make these decisions based on just budget alone, because if you're going to do something that fails in 5 years, your cost is going to double or triple. So you always want to do something that is not only something you can afford, but it's something that's going to last a very long time. Now, guys, we went over the restrictions posed on implant placement and whether or not they're a candidate based on the position of the implant. But of course, there's the medical aspect that comes into it as well. Okay, so for instance, I'll go over a couple quick things. I'm going to make another video which goes more into details about this. But who cannot do an implant, even if they have enough bone? Well, one of them are heavy smokers. If you've been a heavy smoker for many years, you're going to run into complications. That doesn't mean you can't do implants, but your expectation of having complications should be significantly higher. I've had smoker patients have been on smoking for 20-30 years, and the chances of problems with implants and extractions, having dry sockets, implant failing, doubles or triples. So if you're a smoker, the best bet you can do is to stop smoking a couple weeks before, a couple weeks afterwards, so that you can get higher quality blood to the tissue, because what happens is smoking reduces oxygenation in your blood. So if you stop smoking a few weeks before and after, you increases your chances of success. Doesn't mean you're gonna still do as well as a non-smoker, but you at least give it a better chance of the implants taking. If you've had some kind of osteoporosis medication, such as Prolia, Benivia, and Fosamax, those can also interfere with bone reinhibition. So in those cases, you may have to discontinue medication or do it a year or 2 after you've gotten your shots for osteoporosis, right? There's certain kind of cancer treatments, and some of these radiation and chemotherapies can affect the bone growth. So I've had cancer patients where the implants didn't take. Oxygen therapy is a great way to help out if that's the case. But yeah, those things can also be a problem. And then finally, if you have uncontrolled diabetes, not controlled, uncontrolled, if your sugar levels are all over the place and you're not taking care of it, then yeah, implants may not take, okay? But if you get it under control, you're in good shape, okay? Anyways, we're getting off the topic here. There's a lot of things to consider if you're getting your teeth fixed. Obviously, the mouth and the teeth are all connected together, but those are a couple things to watch out, which can disqualify you from receiving implants. Having said that, guys, the placement of the implant and the jawbone, there's always a way to figure it out. Like I said, if you want an implant, you may have to do some additional procedures, but if you go to a skilled dentist, they'll find a way to make that happen for you. And as implants are becoming more and more prevalent and more people are getting them, the prices are coming down. As more and more dentists do, the prices will continue to come down. And hopefully we'll reach a day where you can just go and 99% of people can receive their implants. So guys, that's pretty much what I had to share with you in my final thoughts. If you have any other questions, guys, please leave your questions in the comments in the video. I'll be more than glad to get back to you guys. And I hope you enjoyed this video. Be sure to check out my other videos, and I'll see you guys next time.